Should you exercise because you want to compete with somebody else? Or should you exercise like a 6-year-old who enjoys working out, jumping, playing? The best benefit of any exercise is seen only when you exercise like a child. That means play. Exercise should be play all day long like a kid. That means be happy, play. That's the secret of exercise. Not running on the treadmill. Useless. It's not going to work. Not because you have to run because your wife is asking you to exercise. Even worse. Exercise should be like a kid. I have a 7-year-old now who just turned 7. I can't keep him still. He's constantly moving. He's constantly jumping. That's the type of exercise you have to do. Dance with your spouse. Do whatever you want, but it should be fun exercise. The fourth one is what? I talked about diet. I talked about sleep. I talked about exercise. What is the fourth one?
Peace of mind.
Huh?
Peace of mind.
Attitude. Okay? Don't give a damn. Have you seen a 6-year-old give a damn about anything? Why is that? How is that a 6-year-old is so carefree and walking around happy with a smile on the face, and everybody who's grown up is grumpy and miserable? Why is that? How do you change your attitude? You all go to church. How many of them really practice it? It is so simple. Past, present, future. If you, all of you are absolutely here in the present, listening to me in complete intent, what type of stress do you have? Nothing. What is past? Memories. If you go back into the past and memory, I take $10 from him. Let's say I took it 10 years ago. The first thing when he sees me, what does he say? That son of a bitch took $10, never gave it to me. And he's already pissed off at me. But in 10 years, have it changed physically, chemically, emotionally, intellectually? I've changed. I'm continuously changing. That means he's fighting with what? My ghost in the past. So if he starts fighting with the ghost in the past, is he ever going to find peace? No. But if he does not fight with that and he just looks at me the way I am, does he have an issue with me? No. So then the question is, future. What if? When does the fear of what if come into the picture? When you drink caffeine, drink Coke, drink tea, drink coffee, drink green tea, what happens? Oh my God, anxiety. What if? What if? What if? What if? Why does that what if come into play? That's the future. So where do you live? Complete fear. So when you give up the past, when you give up the future and stay in the present, that means only a child can enter the kingdom of heaven. Where does a child live? In the past? Heck no. Future? Doesn't even know what it is. Does he have to worry about college? No way. Where does he live? Absolutely in the present. So if you live like a child with absolute present, where are you? In heaven. What do you need? So when you are focusing on your breathing, what happens? When you are erratic breathing, your thoughts are erratic. When you regulate your breathing, what happens to your thought? They become calm. You stop breathing, what happens to your thoughts? They stop. You start breathing, thoughts start. So what happens? You focus your breathing. You focus your thoughts. You focus your thoughts. You control your actions. You control your actions. You control your outcomes. So it is so simple. Every time you have a negative thought, what is the one thing you should do? Open the Bible and read a passage. Every time you have a negative thought, just stop, open the Bible, read a passage. What happens to your negative thoughts in 48 hours? Gone. Will you have any negative thoughts? Absolutely none. So then, if you change your attitude to be absolutely like a child, what medical problem would you have? Diet, eat 5 times a day. Do not eat salt, sugar, starch, bad fat, caffeine. 2, sleep like a child. If you have a great attitude, sleep like a child. 3, play like a kid. 4, don't give a damn, be in the present. What medical problem would you have? Thank you. Now I'm open for questions.
Can you say a couple of food items that you can eat, like separate for in your daily?
You have to learn one thing. Whatever you lay your hands on, okay, when you wanted to come to the United States, what did your parents do? You have to figure out where in the United States and then how am I going to get there. Similarly, if you're going to sit down to eat, you would ask a question. Any food you look at, first question you ask, does this food have salt, sugar, starch, bad fat, caffeine? Yes, I'm not eating it. As simple as that. So now let's play a game. I will tell you, eat Cheerios with skim milk. What are you going to say? What is skim milk? Sugar. What is Cheerios? Starch. Why should I eat it? I'll come and tell you, hey, eat bananas. Kerala is loaded with bananas. Bananas, good for you, full of antioxidants and potassium. You'll say, okay, what is a banana? Fruit. What does it give me? Sugar and starch. Why should I eat it? Somebody say, oh, eat blueberries, full of antioxidants, cancer preventing, dementia preventing. You say, stop. What are blueberries? Sugar. If a diabetic eats blueberries, what happens to his blood sugar? Goes up. So why am I eating it? Someone says, hey, eat honey raisin bran. What is honey? Sugar. Raisins, sugar, raisin bran, starch. Why am I eating it? It is so simple. So that means if you have the fundamental questioning of anything you look at, you start asking a question. People will say, hey, eat brown rice better than white rice. You say, okay, what is brown rice? Grain, starch. Why am I eating it? Oh, eat beans full of fiber. Okay, what are beans? Starch. What are lentils? Starch. Why am I eating it? So what can I eat? Well, can I eat eggs? Okay, does egg have salt, sugar, starch, bad fat, caffeine? Absolutely not. Lean meat, red meat or beef, buffalo, pork, sheep, venison, duck, chicken, turkey, goat, anything lean. Does it have salt, sugar, starch, bad fat, caffeine? No. 30 different non-starchy vegetables. Do they have salt, sugar, starch, bad fat, caffeine? No. Spices, do they have salt, sugar, starch, bad fat, caffeine? No. Sprouts, alfalfa sprouts, broccoli sprouts, spicy sprouts, radish sprouts, sunflower sprouts. Do they have any of these? No. Nuts, except cashews and pistachios. Most of the nuts don't have any of the things I was talking about. So you can eat all these things all day long and never have to worry about any of the problems. Then the question, yes, go on.
Do you recommend 5 times eating a day?
Eat as many times as you want. But the secret should be, after 5 o'clock, try not to eat anything. The healthiest patients I've seen so far are the ones who quit eating after 5 o'clock. 5 p.m.
5 p.m.
5 p.m. to stop or?
5 p.m. to stop. The healthiest, see, everything in this country, remember, what I'm doing is not a prescription. It is a choice. It is your choice. It is your choice to either make me rich or make me not give me your money. But that is entirely yours. Meaning, if you don't want to eat it, hey, that's your choice. If you get sick, that's your choice. It's a choice. Nobody's putting a gun to your head. But if you're asking me, what is the best way to eat? Big breakfast, snack, lunch, snack, nothing after 5:30. Why? That is the best way you can protect your health. I don't want to do it. Hey, that's fine too. I don't care if I get sick. I had a Malayali patient who came in. Father had died prematurely, brother died prematurely, sister died prematurely, and uncles had heart disease, and he's 46. So I asked him, I told him all these things. I'm not interested. All I'm interested in 15 more years. Okay, then I'm wasting my time. Just enjoy your life. Then on the way out, I say, no, maybe 20 years. Now you're trying to negotiate with me. That's your choice. You decide what you want to do. That's your life, not my life. So, hey, you have a choice to live to be 100. You have a choice to live to be 50. That is your choice. You can be dead for 12 billion years. You could live for 100 years. That's again your choice. But that comes with a few sacrifices. And you have to be willing, not your wife, not your kids. And if you don't give a damn, go for it. Don't complain when it comes to paying co-pays. The toughest patients I've had are Malayali patients who refuse to pay their co-pays. Why? They're loaded with money, drive Benzes, but they don't want to pay co-pays. And explain that to me. Now they don't want to change their diet, but they want good health. How is that going to happen? Questions?
What are those vegetables or food that doesn't have starch or sugar?
That's your journey. I'm not going to spoon feed you. You're going to start investigating. You're going to start asking questions. You're going to look into it. You're going to Google. You're going to find out what it is. And if you've been reading Archavatam, I've been putting up all those information on Archavatam magazines, the newspaper. Every week there's been an article talking about what to eat, what not to eat, and how to eat. But I'm not going to spoon feed you. You have to have initiative and say, hey, this is my damn health. I don't want anybody giving me medications. I'm not going to be sick. I don't want to be sick. I'm going to change the weight. That should be your passion. Not me telling you, it's all full of bunch of crap, I'm not interested. No, that's your choice. You want to find out? Find out. Hey, what is a potato? It's starch. Hey, what is a sweet potato? Starch. What is yam? It's starch. What is carrot? Sugar. What is beets? Sugar. Man, why are these people eating all those things? Start asking questions. That's the point. Remember, the fundamental truth is 99.99999 Malayalis cannot change. Why? Because we discuss what? Addiction. Unless you confront the issue that, hey, this is an addiction, I am willing to change, only then the program will work for you. If not, don't waste your time. Enjoy your life, keep seeing your doctors, take your medication, don't fight it. But if you want to change your life, you have to first understand that, hey, there's an addiction, I need to change. Unless then, it is not going to happen. Questions?
What you suggest about those who have hereditary disease like diabetes and hereditary?
Very good question. Very good question. Is diabetes hereditary? Yes or no? No. It is purely diet. And depending on how much sugar and starch you've been consuming, depending on how much stress you've been taking, and depending on how much less exercise you've been doing, you will develop diabetes. It is not hereditary, but you have created a chain and link that is going to go on with your kids and grandkids. So do not be blaming the genetics, but focus on the food. Now, even the patients who are coming to me have changed their diet and given up their insulin in one day. How is that happening? They have gone on my diet, they have gone on my bread, and in one day they are giving up insulin. They are giving up insulin pumps. How is that happening? Changing the diet. I came up with a bread called the Reddy bread. It's made from soy and flax. It's so simple. You take the bread, eggs, bread, meat, bread, vegetable curry, bread, guacamole, bread, alfalfa sprouts, avocados, and spinach. Roll it up and eat it 5 times a day. Your blood sugar will not go up. If your blood sugar will not go up, do you need to take medications? No. That is so simple. But it is so hard for Indians to do it. The reason I created the bread was for Indians, but the guys who are eating are African Americans, Hispanics, and Caucasians. And they are, in fact, Monday I'm taking 2 patients to Deborah Duncan show. The first patient lost 40 pounds in 3 weeks on the bread and diet, eating 4 times a day instead of 2 times a day. The second lady, 1963, the year I was born, she had a motor vehicle accident. She developed a tremor in her right arm. Then she developed breast cancer, for which she was on chemotherapy, developed neuropathy in her legs. Then she developed diabetes, high blood pressure, obesity, sleep apnea, atrial fibrillation. She came to the office, was crying for 2 hours, changed her diet. In 13 days she came back, she lost 13 pounds, off blood pressure medication, off diabetic medication, sleeping well, feeling extremely happy. But you know what 2 important things? The tremor which she had for 48 years disappeared. Now she can hold her hand. And the neuropathy which she had for years from chemotherapy disappeared in 2 weeks. Explain that. How did that happen? Did I give her prescriptions of medications? No. Did I give her supplements? No. Antioxidants? No. All I said was, eat the right food, and if you want the bread, try this bread. That's it. That's exactly what she did, and she is ecstatic. She could not walk without shoes. Now she walks on barefoot on the floor outside because her neuropathy is improved in 12 to 13 days. Patient, 21 years of diabetes, on insulin, comes in. Angina, bypass twice, could not go for 3rd time bypass. Every time he walks, he has chest tightness. Goes on the diet and takes the bread. Comes back 1 month later. Neuropathy, gone. Blood pressure, normal. Blood sugar, normal. And angina, gone. 1 month. How is that happening? I took him off medication, not putting him on medications. The guy is ecstatic. So the moral of the story is so simple. Treat your body with respect. It will heal. Give it the right kind of food. And if you want bread, the Reddy bread. Simply take the bread, put some olive oil on it, smear it all in, put in the toaster for 1 to 2 minutes, take it out, roll it up, or may take it, eat it like a chapati. It's unbelievable. People are actually, the Caucasians are actually making pizzas out of it. Very low fat cheese, olives, and lean meat, putting it on there, eggs, putting on there, making pizza for 4-5 minutes.